quality of care is a place where people have access, but a place where people are welcome, and a place where an organization attempts to understand the culture of the people from within their boundaries that they serve.
One of the things that we really look to do with the Collaborative for Community Wellness is to think differently, to bring the voices of the community residents to the table, to bring these conversations to policymakers, to very intentionally not try to repeat the mistakes of the past, but very intentionally try to create solutions where meaningful investment can be made in the social infrastructure of the city to really address the issues of violence.
The Collaborative for Community Wellness is a coalition of organizations and healthcare providers it came together basically through a recognition of this profound disparity in access.
For us to understand that issue in its complexity requires diverse voices to come around the same table to talk about the issue and the issue of health equity when it comes to mental health access in a very intentional way, to find creative solutions and meaningful solutions that can change course, that can really provide a new view on what mental health and emotional wellness looks like for low-income communities of color.
And I think what we've done with the Collaborative for Community Wellness is really build a model for that type of cooperation, and build a strong sense of kind of how communities can come together to ensure that everyone is being served effectively and that we're addressing health disparities and building health equity.
What health equity means for Erie Neighborhood House is making sure that our community has access to the services and resources that they need. Oftentimes that comes in the form of collaboratives across communities to ensure that we're coordinating the care that our families need.
So we play a role in raising their voices, as well as preparing the community to use their own voices to advocate for issues that are affecting them directly.
And so community health workers really are essential parts of the community. They are leaders within the community who are trusted, who have a wealth of knowledge and information as well as life experience. And they really serve as a point person within communities as leaders that have information about where to go for what kinds of services.
Las promotoras de salud podemos como que llegar más a fondo en la comunidad porque conocemos la cultura, porque conocemos también las necesidades de la comunidad, conocemos cómo llegar a la gente, cómo hablar con la gente, digamos, hablamos su mismo lenguaje y eso siento yo que ayuda un poquito más a los profesionales a entender por parte nuestra, por parte de las promotoras, a la comunidad.
Every community is its own unique, has its own unique language, has its own unique way of processing things, has its own unique way of gaining information. So what this collaborative really helped us do is tailor-made it to the community that we exist in.
I think about transformation. I think about how we evolve as a community, as systems, as a society to better address the needs and really work towards health equity in a way that's very meaningful, that can really deconstruct and be very innovative, very disruptive in understanding how solutions have to transform and have to really bring different stakeholders to come up with entirely new options and new possibilities.
We sowed plants, and now we're going to enjoy the fruits of all that labor, and it's going to work for generation to generation and systematically set it up for positive effects.